All right, colleagues, we're going to go ahead and get started. This is a meeting hosted by the Agency of Human Services on a new care coordination initiative for folks in the Transitional Housing Program. We are recording today's meeting, and this meeting then will be a public record, so will the slides. And because we're recording it, we also just want to remind folks that you should refrain from sharing confidential information. You're also welcome to turn off your camera, and I'll just give a friendly reminder that everyone should mute themselves except when we're ready to talk. So with that, I'm going to go ahead and share some slides and get us started. Great. So today I'm Sarah Phillips, by the way. I'm the director of the State Office of Economic Opportunity in the Department for Children and Families. Our office works with a number of organizations across the state, community organizations that deliver housing support services and homeless assistance around the state. So know many of you on this call, but of course not all of you. Today we're talking about a new Agency of Human Services housing initiative. We're calling it the Care Coordination Transitional Housing Program Resource Teams, and you'll learn more about what we mean by that in just a moment. So I'm going to facilitate today's call. Again, I'll just say it one more time, and then maybe midway through the meeting, remind folks who have joined us, but our meeting is being recorded. We'll make that recording available to folks. The recording and the slides are public records, so just be aware of that, and please refrain from sharing any confidential or protected information. I want to introduce our state team that's here today. Someone muted me, but I unmuted myself. Okay, I'm going to go ahead and see if I can't pin people to your screen so you can see them as they're talking today, but I'll let them introduce themselves. So Hib, why don't you go first?
Sure, thanks, Sarah. I'm Hib Doe. I'm a field service manager with Higher Ability of Vermont. Formerly known as Voc Rehab. We rebranded early this year. Great to see everybody here.
How about Dave?
Hi, everyone. My name is Dave Regal. I'm the Agency of Human Services Housing Director, and pretty new and pretty excited to be involved in this work. So thanks.
Great. And Renee?
Hi, everyone. Good afternoon. I'm Renee Weeks. I'm the Director of Complex Care and Field Services for AHS.
And Andy?
Hi, everyone. Andy Lange, DCF Economic Services. I'm an Economic Benefits Director there.
Oops. Okay. I may have just pinned people for myself and not everyone. Okay, I'll keep working on that. Hopefully you can see people when they talk. So some goals for today. We want to provide for you an outline today overall about what this initiative is, what the agency is trying to accomplish with this initiative, how the agency wants to partner with community organizations, particularly those providing housing supports to folks in motels, right? And also just to name that as part of this meeting, the statewide team is really looking for your input and your feedback around the initiative itself, right? And that as is sometimes the case with this good work that we're in, we are launching it and getting going, but we'll hope to make changes along the way to make sure that it's working effectively. So we'll talk a little bit where we're at in the process, but just really encourage your input today. So if you hear something, you have an idea around how something could work better or what you'd like to see, that's all welcome today. Okay. So I'm going to turn it over to Hib, and he is going to just provide a general overview for everyone.
Great, thanks, Sarah. So why are we rapidly standing up this program statewide? As most of you are well aware, the Transitional Housing Program will end on March 30th of next year. And these care coordination resource teams are being established so that we might reach all of these transitional housing program households and connect them to services in the month ahead, anticipating that deadline. One other goal of this project is that we also want to better understand the needs and resource gaps as we connect with participants and local staff statewide. The results we're looking to derive from this project are to remove barriers to services and housing for individuals on the transitional housing program, as mentioned above, and also identify community and state level resource gaps. We're also looking to have statewide leadership use the information that is gathered to inform decision-making and support during the life of this project and going forward. So who's going to do this work? The AHS team will consist of 3 separate staff, 1 member from Higher Ability Vermont, 1 from the Vermont Chronic Care Initiative, and 1 from Economic Services. These teams will partner closely with local housing staff who in many cases know this population best. As there are about 1,500 households on the transitional housing program, 15 teams have been identified to work with 100 households per team. These teams will be district-based to maximize on existing local partnerships. The resource teams will utilize a care coordination model to establish goals with participants and identify supports necessary to assist them with achieving those goals. The state leadership team will provide ongoing support to the resource teams as they are established statewide. So when is all this happening? As of about a week ago, we started with a soft start in Barrie at the Hilltop Inn, and we're using lessons learned there to establish the care coordination resource teams in every community later this month and through November. The team's work will continue through the end of the program, which, as I mentioned earlier, will be in March of next year.
All right, so I'm going to take a few minutes to kind of walk through what it is we effectively just sort of have in mind as we're making our way through this process and standing this initiative up. So the goal is to, perform outreach, which is going to look like direct contact to all households in the transitional housing program. There's been a release developed, and we'll touch on that a little bit later on, but essentially, obtaining consent from households to participate and permission to share information. Developed a standard screening tool that, as Hib mentioned, is being tested, and we're gathering feedback on that from folks in Barrie at one of the locations right now. Utilizing a shared care plan to try to determine what the different needs are of households and the best way to address those and connect people with the resources available in communities. Case coordination and conferencing, so the local teams in partnership with the housing support providers at the community level, looking and evaluating and deciding who's best to really lead and support the different households, and making really clear with folks that at this point in the process, participating in this initiative is voluntary. And if it changes, which it could change, we'll make sure that folks receive notice of that change and have an opportunity to participate at that point. The other thing that I would say is that I think we all want to recognize the work that's gone on over the last 2+ years and the efforts that all of you have made in this work and really the strides. And the goal is to bring some additional supports to that work that you all have done and leverage on your local expertise. So I think that the next thing we're going to look at is kind of the breakdown of the different communities. I don't know if we can switch to the next slide. There we are. So looking at the different numbers of households in the regions throughout the state and the goal of the teams trying to support roughly 100 households at a time. Economic Services helped to kind of break down the different regions. And as you'll see here, some communities have one team and it's pretty clean and straightforward. And then there's other communities that have much larger numbers and look to provide multiple teams to those areas to partner with the local folks to really stand this up and support the guests in the transitional housing program. And we can go to that. There we are. So what you can expect when this initiative makes it to your community is an email from me. Probably be pretty short and sweet and to the point, but the goal is to just let everybody know that we're prepared to get started in your area and that there will be an initial convener of a meeting bringing together staff from the different departments at the Agency of Human Services along with the local housing support providers. Economic Services will provide notice to everybody in the transitional housing program in that local community, as well as the operators of the hotels and motels, just to give everybody a heads up. And they'll also start to try to get the releases signed. So the Economic Services has been willing to take the lead on that and just get the ball rolling as the local team is coming together and starting to have some conversations. Then that initial meeting, our goal is to provide really just kind of an introduction of all the different players at the local level and let the teams get to know each other a little bit and really start to talk and think about what makes the most sense. We recognize all different communities have a variety of different resources. There's a variety of different factors at play, and we don't pretend to know what those are. You folks are the expert on your local communities, the folks from the different departments who are working in the local communities know those things. And we just want the teams to be able to come together, talk about what makes sense and work through how this process could be best carried out locally. And then it does become about the outreach, the direct contact with the different households and completing the screening tool that we'll touch on a little bit later. And the goal is for them to take the information learned from the screening tool and come back and huddle together as a local team and make some decisions about who on the team might be best situated depending on what the needs of a household is. Some households are already going to be connected, and those of you already working with them are going to say, we're going to keep the point because we know these households and we're already doing a great job. That's fantastic. There may be other households that really have a need for some, help in workforce development, and maybe it makes sense for the person from higher ability to take the lead on supporting that household and connecting them with the different resources. So, again, it's about that local coordination and contact and whatever makes the most sense in terms of providing that ongoing care coordination. And then over the remainder of the period of time where the transitional housing program is still in effect, we really are hopeful that there will continue to be contact with the different households, somewhere in the ballpark of twice a month or so, just to make sure that they're receiving the support that they're looking for and that their needs are understood. The goal here is to really sort of address the social determinants of health and utilize a care coordination model to be able to do that. I think that wraps up this slide.
Great. And hopefully it moved to the next one. There's a little delay. Maybe Renee was going to talk about the screening tool.
Yeah, thank you. And the new slide is showing, Sarah.
Great.
So we've developed a very basic screening tool. The intent of it is really to help identify what some of the needs of the households are. And we know, because we hear from many of you, that many of the needs are beyond housing and rental assistance. And our goal is really to work together as a team to try to get people connected to things related to their goals. So the screening tool asks a few questions about housing barriers and needs, and it's not in no way meant to replace the coordinated entry tool, which is much more comprehensive. But it's to help us identify if someone hasn't connected with the coordinated entry assessment piece yet, or hasn't been able to connect with a housing provider. We also ask questions about employment, vocational training, needs or wants, interests, and we also ask questions about healthcare. And when I say healthcare, that's inclusive of mental health care, substance use, disorder treatment, etc. Sorry, I'm multitasking here, letting people in. We are developing a software application to collect this information in so that it's easy to use. That is still in process. The Berry team that's been great in soft launching this has utilized the tool that's presently in an Excel format with many drop downs. So it's pretty easy to ask the question and just do a click. There is some write-in information for narrative, but that's pretty limited. The Berry team is reporting that doing the screening tool is taking about a half hour to do with each household. So it's pretty quick. I'm sure for some households it's quicker than others. It depends on how much people want to share their stories with you. And we will, I just got the final refinements from the Berry team today on the tool. So once those revisions are made and we have a final tool, I'll be able to share that tool with everyone. And we can go
Great,
to the
thanks.
next slide. Oop,
Yeah, and
sorry,
I'll just, no, that's okay. I'll just name, folks can go ahead if you want to put your questions in the chat box. We'll keep going. We're almost done with just an overview of the initiative, and then we'll have lots of time for questions and answers. So please go ahead and ask your questions. I'm going to save it till the end for now. Thanks.
Great. And I think Hib referred to our informed consent and confidentiality form earlier. There has one that's been developed. The economic services team has been going out and getting those signed by folks who are willing to sign them, which has been the majority of people in our experience thus far. The screening tool will be used to help us understand what people's needs are and what some of the gaps are in the community for care needs in general. It's also to help us inform who best to assign to that case if they're not already working with someone in the community. For example, if someone in the hotel program is, wanting to improve their employment situation so that they could earn more money so they're able to afford housing at some point in the future, they might get connected with the higher ability case manager to work on that and have access to those resources. So local teams will set up their own process for information sharing. Each community looks so differently and has different partners and resources. So they really need to be the ones to set up how that would work best in their communities in the most efficient way possible. The releases that have been done are by region and include the community partners on there. And there's also additional areas on it for writing in people or other providers who the person might be working with who aren't listed in the list of community providers. So we can take any questions or comments that people have at this point.
Great. And I'm going to stop sharing. And now I'm going to attempt to spotlight people. And if you have a question, you are welcome to raise your hand if you have that capability. You're welcome to use the chat box. And if you don't have a little raise the hand Teams thing, you're welcome to just turn on your camera and literally raise your hand, and I'll do my best to call on people that way as well. So I'm going to start with, I'm going to remind people to mute themselves if they can. My colleagues on the call are going to help us manage that. Okay. And I'm going to start with the chat box. So I might, if you're willing, I might call on you to ask your question. So Jess Horner from John Graham, did you want to ask your question out loud?
Sure.
Right.
Thanks,
Great.
Sarah. Being on the ground throughout the day, understanding that these bureaucratic processes are very confusing for clients. They sometimes can't even tell, what their HAP form is, or what, there are so many papers they're keeping track of. I'm wondering what will be offered that we're not already offering that will make the administrative burden of this sort of worth it and not more cooks in the kitchen.
Thanks, Jess. I think it's a great question. And so I'll turn to Hib, Dave, Renee, and Andy. Do one of you want to give that a start?
Yeah, I mean, I'll take a run at it. I think the goal is really to provide additional support and resources and look to the local team to be able to work together in the roughly 100 or so households and make determinations about who is best situated to be able to support that household. It's not about duplicating or overlapping or laying over work that's already being done. If a household is connected, they're working with partners and feeling really good about the support that they're being provided, that's fantastic. We want to know that by having the screening tool filled out and being able to utilize that information for decision makers as this next several months go by. But we're not trying to duplicate or put too many cooks in the kitchen. It's just about supplementing in the areas where it is helpful.
The one thing I would add to that as well, Jess, is that one of the barriers that we've heard from folks in the community is people being able to get to an office or to use the telehealth technology to connect with services. And in this model, if someone does need a higher ability visit or help connecting with healthcare through a Vermont Chronic Care Initiative nurse, those services will be provided on site, and those people will be able to help with the barriers to accessing care and services, in addition to what you all are already doing. So it's just a different, rather than you guys saying, oh, call higher ability, well, higher ability is right there to help them and meet with them in person.
Yeah, thanks, Renee. Yeah, I would say the same thing. Like Dave mentioned that, we're working with people across the state through higher ability, and those folks will remain with their current counselors. We're not going to just switch people up, but if those existing relationships are working great, we're gonna stick with those.
Yeah, I mean, a lot of our work throughout the day is addressing these barriers. So we're getting people to appointments, we're setting them up with telehealth, we're making those calls. So it feels a little daunting to have another cook in the kitchen so that we all have to meet and talk about that. But I'm going to try to be hopeful. Thank you.
Thanks, Jess. And I appreciate you chiming in there. I think your concern is what I'm seeing in a couple of other chat boxes as well. And so I think it's really helpful for us to have that conversation today and to hear from all of you what you see as the value add for clients and for you all as providers as well to try and shape this initiative to be really effective. So thanks for weighing in with that. I see a couple hands up, which I do see, but I also see a couple chat questions. So let me jump back to this question, which is, we received notice last week that our VCCI program is full and can't take any referrals right now. So how is this going to impact that process? So Renee, maybe I'll point you to that one.
Great. So yes, we are not taking referrals in some areas of the state right now for BCCI so that we can fully support this program. We are working on backfilling those positions so that we will be able to open up referrals, hopefully sooner rather than later. So it should just be a temporary hold on referrals for those areas.
Thanks, Renee. How about Elizabeth? You've got your hand raised. Do you want to ask your question?
Yes, this sounds like almost another field navigator function. So it's not completely, I don't know everything about this, but I hope that that's clarified as far as how this will interact with both housing navigators under HOP, et cetera, and also field services navigation.
Yeah, thanks, Elizabeth. I think, let me see if I understand your question correctly, which is the work that is being talked about sounds like some of the work that our community partners and others already have staff in hotels and working with these clients already doing this work. So maybe not unlike Jess Horner's question is to say we have staff that do this similar work. So how do you all see this team working with those staff? Maybe we can speak more to that piece. We just kind of mentioned that that would happen and get figured out, but maybe you all can share a little bit more there.
I can speak to that. So in Barrie, we met with community partners and had a meeting to discuss how we would work together in the community moving forward and assessed what their capacity was with how they wanted to interact with this program. This program is not meant in any way to duplicate any services already being provided. So it may well be that, different communities will have different capacity of resources. So it may be, Elizabeth, in your community, you guys are already super connected with everyone in this program and meeting all of their needs. And we wouldn't jump in and replace that. This would be just more of a support service in your community then, but that's something for you and the teams to figure out what will work
No, I
for your
think it will
community.
help. I don't think it's been entirely clear how to integrate the field navigators into the existing structure anyway. So this, with more communication, I think can help do just that. So yes, and I see that as making the most of those positions anyway. Thank you.
Great. Thanks, Elizabeth.
And there will be like launch meetings, Elizabeth, that you would be invited to, so you could help develop what that working relationship will look like. So
great. And I'll just say some of you may have questions that are really specific to your community or your programs, and those may or may not be questions that we can answer well today. But I think know that when, as Dave was talking about, sort of when this comes to your community, how that will look, and that initial email will come out inviting sort of a local team meeting to come together to have some of these conversations and think about how this work complements and work and how the work on the ground works together. And I think that OEO has a good sense of the organizations that are doing work in hotels right now. And so we'll be able to make sure that the right community partners are included in those local team meetings. So that's part of the goal of that meeting. Okay, lots more questions. So I'm gonna flip to raised hand. So Bet, do you want to unmute and ask your question?
Yes, it's actually Beth, but now Teams got it wrong. I'm just curious about the screening instrument. Is it possible to share that with people?
Yes, absolutely. So today we got some revisions. The team just started using it last Thursday. So we wanted them to use it and then give us some feedback after practicing using it to make sure the flow was just right and everything. So we captured some feedback from them today. We're making those refinements and then I'll be able to share it.
And I think our hope is to be able, the team's hope is to be able to get it out to partners around the end of October. So that's the timing on that. Great. Back to the chat box. And I'll also encourage folks, when you do ask your question, if you can name your organization, I think that's always helpful, or your community, that's always helpful too. Not everyone knows everyone. Okay, so Jess Hyman from CVOEO asks, will the data from the tool be easily transferred into an existing data system? And so that's one question. And will the tool have a, quote, shelf life beyond the transitional housing program?
The first part of the question was we are hoping that it will go into a database that's being developed right now. It needed to wait for the final version of the screening tool itself to be able to develop that. In the meantime, we are using an Excel version, that information will then be uploaded into the database. So all the information will be captured there. And then what was the second part of the question, Sarah?
About will the screening tool have a shelf life beyond the transitional housing program?
At this time, no.
Yeah, and thanks, Renee. And just to clarify, I think Justice's question maybe was, is it going to translate into an existing system like HMIS or an existing database? And I think the answer is no. It is going to be entered into this new software application so that there can be some analytics and aggregate data, but not, the goal isn't to integrate it into another system, if that's correct. Okay, great. All right, let me go back because I don't want to miss some of these great questions. How will survivors' identities remain confidential as part of the care conferencing and screening? And Renee doesn't have to answer them all, but feel free, team, to maybe Dave, you want to jump in on that one? I know the team started to do some thinking.
Yeah,
on that.
I mean, it's certainly not my area of expertise for sure. I mean, I think that the goal is for, the local teams to be able to really understand the folks that they're working with and make sure that people's privacy and confidentiality are maintained where necessary. I don't know, like we had said earlier, participation right from the beginning is certainly voluntary. We don't want to force anybody into anything at this stage of the game. And if other people have ideas about the best way to go about doing that, I think, it'd be welcome to hearing those suggestions, because we certainly want to be, respectful of that type of a situation.
Yeah, and I don't know, do you want to unmute yourself and ask your question or offer any thoughts there? I think that was, can't find who. Yeah, great.
I can do that. Thanks, Sarah. Hi, everyone. This is Kira from Steps to End Domestic Violence. We serve Chittenden County. So that's helpful to know. I mean, I think I'm going to request, and I would think the other agencies would too, that we have a meeting with the local teams ASAP. So we can talk about a process that works with each of our agencies. I think mine in particular is, as outreach is happening, if someone identifies as being a survivor or working with us, we get connected immediately. But also with this internal system that you would upload the screenings, how can we assure that our survivors' names will remain confidential? We don't currently use the HMIS system that everyone else uses. We have our own internal one that the network uses. So just want to know how we can maybe de-identify names and what that could look like if that's the case.
Thanks, Kira. I thought that was you, but I couldn't find your name in the chat box. So I appreciate some more thinking should go into that piece of this work, and appreciate the note to include those DV agencies on those local team team meetings as well. Sherry Marcelino, you got your hand up as well. Do you want to unmute and ask your question?
Yeah, can you hear me okay?
Yep.
Great. So I'm interested on how this process and this team may be helpful for individuals who really need a higher level of support in order to be successful in sustaining housing. So I guess what I really mean is we have quite a few individuals who may be elderly or significantly disabled, where it's really been shown by our contact with them, or maybe by an actual choices for care assessment or a TBI assessment, or whatever their story might be, that they actually need a shared living provider or assisted living or things of that nature. But there's a major bottleneck in the system, so that our current process, we haven't been successful in getting people into those services. Will this team be able to help us advocate and navigate that level of care, in addition to increasing our ability to offer long-term housing support for people that need it?
Sherry, thank you very much for bringing that up. That was a really well thought out and very articulate way of framing it. The goal is for the screening tool to be completed, and then for the local teams to come together and decide which one is best situated to support the household. And then as that support is going on, really try to lift up any barriers or challenges to the field service directors first, and then the field service directors will be then escalating things that are outside of their ability to support with to the secretary's office at the Agency of Human Services. And our goal is to really understand and evaluate those different situations and be able to start to talk to some of the different resources out there in the state of Vermont and figure out exactly, how we can start to do that advocacy that you're asking for. So that is our goal, and to try to really understand in a long-term way what the needs are and how to go about creating plans for addressing those needs.
Sherry, any follow-up there?
No, I guess my initial thought is thank you for continuing that work. I feel like most of us are probably exhausted and already trying to do that. So it feels frustrating and thinking that another set of eyes and another pair of hands could be heard louder than the ones that are already doing the work. I think I just have to say that, like, that doesn't feel good, but it feels great knowing that there's going to be a new energy and a new workforce putting into that, because it's so desperately needed. I also wanted to echo one of my colleagues on this call, where they made mention of a DMH, or a Department of Mental Health representative, or someone from Dale, to really capture the needs, the specific needs of getting folks into intensive mental health or developmental services as needed. There's another big bottleneck in that.
Yeah, thanks, Sherry. I appreciate that. Yeah, and I see that chat comment. we'll try to get through a lot of them. We booked a lot of time for this meeting with folks so that we could have a lot of questions and answers too. So thanks, Sherry, for lifting that one up especially.
Thank you.
Great. All right, Jess Graff, you had a question. I'm happy to read it for you unless you want to unmute. Okay, I think the question is the support available for everyone in economic services motel programs, not just the transitional housing program? In other words, other people who are in GA emergency housing and in motels. Andy, maybe that's one for you.
Yeah, we're starting just with the transitional housing population.
Great. And I'd just say, I think, and this is in the slides too, right, is like part of the goal of this specific initiative is that the transitional housing program will end. And so part of the goal is to ensure that there's some additional muscle out there to try to reach every household in the motels. So that's the impetus. All right. Molly has a question. Molly, maybe I'll just read your question. It's pretty self-explanatory, which is, will people have long-term access to VCCI support if needed? So Renee, that's for you, I think.
They will have access to VCCI as long as they're connected and needing it. If the program ends March, it doesn't mean that their care ends in March. But with that being said, VCCI is not a long-term program or support. It's intended to be a shorter term program to get people connected to healthcare services that they need and get their healthcare conditions managed, and then they back out. So.
Thank you. Just a follow-up on that question. So a lot of folks are living in communities they don't necessarily want to live in, just where hotels were available. So I think that's one of the reasons I was hoping there was access to those supports afterwards as people continue to figure out where they land in the state. So thank you.
Yeah, and the answer to that would be yes, Molly, that would continue as long as the need is there to get them reconnected back to services in the area they return to.
Great. And I just want to acknowledge some of my other AHS colleagues are doing a great job responding to items in the chat box. I'm still going to try to read them out loud for the sake of the recording, so bear with me. But that was a great, Molly, that was maybe a great segue to another point where somebody in the chat box was lifting up, particularly for DV survivors seeking safe and affordable housing. It may not be in the area that they're currently housed in or located, right? And so I think this is a question really beyond DV, right? Because Molly's naming it it's for a lot of folks who may be housed in one county but might be seeking housing out in another county. So I don't know, how does the team, maybe one of you want to talk about how you all are thinking about this piece of care coordination for folks who are in one community but maybe need to get connected to resources in another community.
I mean, I think yeah, go ahead, Renee. Sorry.
I was just going to say the teams can work together to outreach to those resources in the community the person wants to be in as they get close to being able to make that transition, to make those service connections happen.
Yeah, I think that's right. We want to support people being where they ultimately want to be as best we can.
And yeah, I would say too that we're going to have teams in all the districts, which will be great. So I mean, there's going to be that collaboration between the teams that can happen naturally.
Okay, great. And Tammy Santamore from COTS, you had your hand raised, you put it down, but you were on my radar screen. Did you want to ask a question?
I appreciate that. I think Sherry hit most of it with the inclusion of Department of Mental Health and Dale in those services, just because what we've seen in Chittenden is significant mental health and substance use being a pretty heavy barrier to engagement, and also obviously attaining housing and sustaining housing. And what we want to do is obviously help people retain it. So we know they need pretty intensive services, and our designated agency in this area in Chittenden, and I imagine across the state, is pretty strapped. And so how will those folks get pulled in? But I think you kind of addressed that already.
Mm-hmm. Oh, Renee, you want to unmute?
Oh, sorry. Just to add to that, Tammy, like we do know like many people are not engaging in services that they may be in need of. And our hope is to continue to outreach to those folks who even choose not to participate with us or sign a release. Ask them like, is it okay if we just check in with you a couple times a month and see if, you know, you have a goal that we can help you with? Because in our experience, we know that many people today may not be ready to engage, but in 2 weeks they might be able to, but they might be afraid to come to us and ask. So we really believe in a continuous process of outreach for those folks.
Great, thank you. Yeah, and just there's a couple other chat box comments around the need to have DMH, much of the unmet need being mental health support and developmental cognitive functioning support needs. So thanks for lifting that one up. Katrina James from Capstone, I see a couple comments from you here, and you're welcome to, I can read them, or you're also welcome to just share your thoughts if you want. Okay, I'll just.
I'm trying.
Oh, great. No, go ahead.
Thank you. I don't mean to be a negative Nelly or sound pessimistic. We always have hope and we always work together towards our goals. It feels very duplicative, and I know we've already touched on that. I'm very anxious to see how this plays out. There's a lot of hands already in the mixture trying to support folks, and it's really not a lack of support that people are missing. Like we need housing for folks. It's really the biggest deal out there that we all know. So, you know, a lot of this work is being done. Not saying we can't enhance it, but I think working together is going to be very important to kind of feel out what work is already being done, where folks are at. I know here in Lamoille, we're a smaller community. We know most of the folks that are in the hotels pretty well, whether it's through us at Capstone or through other agencies. So I just worry a little bit about adding more people to the mix. And I just want to really make sure everybody is on the same page that until we have that housing, we can throw as many resources as we want. It really doesn't change the situation for folks too much. We've worked a lot over the last few years helping people reduce barriers, helping people get connected with services. All of that work is active and being done.
Thanks, Katrina. I appreciate you vocalizing that and naming that the need for housing and long-term supports for people.
Yeah, that's the other piece too.
So thank you.
Yeah.
Dan Handy from, I believe Groundworks has a question, and maybe I'll just read this quickly because it's pretty straightforward, which is just, we have folks who are housed who maybe were in the program at some point, and could this initiative be expanded to include those households? And I think the easy answer that I can answer on behalf of the group is no, this is an initiative that's for folks in the transitional housing program. Right now, it's time limited in duration. It's meant specifically to meet some specific goals around folks in the transitional housing program. Although I'm hopeful that my colleagues at AHS would agree that there'll be a lot of learning that happens, and hopefully that learning can inform some future work that the agency does. So I took that one for the team. Okay, great. And Tara Chase from Springfield Supported Housing. Tara, do you want to go ahead and ask your questions?
Sure. Thank you, Sarah. My quick question was around the referral process. So, you know, one of the things that, you know, helps to keep us all connected is knowing who is in the motels. And so then when we do have clients that are in the motel, how is the referral process, right? So if I'm meeting with a client and I acknowledge that they could benefit from a high ability counselor or support person in that way, am I directly referring them to you guys? Do you already know who's in the motels? How is that process going to be?
Yeah, Andy, maybe that one's for you.
Yeah, I mean, that team will end up talking about it. So the once the releases are in place for everybody to talk, then I think that the plan is that team will pull together and talk about the information that is learned, and then refer people to the appropriate places. So in that scenario there would be to the Higher Ability Vermont person working on that team.
Great.
Yeah,
and then yeah, go ahead, Dave.
I would just say that you know, Economic Services has the sort of master list. So that's kind of the starting point, is that ESD master list of who's in which hotel and when and which community and all that. And then as the local team comes together and talks, the screening tool is one way to be able to identify what the specific needs of a household are. You folks as housing support partners are the other way. There's a lot of folks you're already going to know. You know, you're going to come to that initial local meeting and start having conversations with the folks from the different AHS departments, and you're going to be able to say, I know this household. I know that their biggest thing is this. And boy, Hib, it would be great if you from Higher Ability actually went to complete the assessment tool with them, because that's going to be the most efficient way for them to be able to get connected to the services that's important to that household. So really leveraging the experience and the expertise that you folks have at each stage of this is going to be critical.
Awesome. Thank you, guys. I just wanted to just say thank you again, because this was something I had mentioned to Sarah a little while ago about like how nice it would be to come together to talk about the different pieces that the clients that we see are facing as like a more of a regional-esque-ness, if you will. And so this, I think, is one of those steps towards exactly that. So thank you guys for coming together and presenting this information.
Thanks, Tara. There's another question from someone on your team. I'm not quite sure who, but just how are the team members being chosen, or will there be input from current housing navigators? So I think there's kind of maybe two parts to that question. One is the state, the members, the AHS staff that will participate on those 3-member teams, and maybe I'll let my colleagues answer that. For the community partners, right? Again, what I said is that OEO, I think, has some pretty good visibility on which organizations are providing housing support to people in motels in the transitional housing program. And so we'll name the key supervisors and leaders from those organizations, who will then identify who's the right people from their staff to participate. So we won't be, so I'll pick on Tammy, right? So when we're in Chittenden County, we know that COTS has a motel outreach team, and we'll be sure to include Tammy in that initial community partner outreach email, and Tammy will identify who from COTS needs to be participating in the meeting. So, and Hib, Renee, Andy, do you want to name sort of how you're identifying your team members?
Sure, this is Hib. We asked for volunteers across the state, and we were able to kind of stand up. We've got participants from every district that'll be part of this, which was great. People were very interested in helping out in this way, which we're really appreciated.
Yeah, same for ESD. We asked for volunteers that basically fit the criteria of folks that were willing to be flexible, think outside the box, and be willing to try new things and to keep trying new things if the first new thing didn't work so well. So that's kind of how we asked for our volunteers, and we did get people that are also interested and want to try it out and stepped up. So.
And in the case of VCCI, most areas have one nurse, so we are having them engage in this program and then working to backfill to provide ongoing VCCI services until they can be pulled back in.
Thank you. Sue Minter was with us. I believe she had to leave, so I'll just read her comment. I appreciate this holistic approach to supporting folks with acute housing needs. However, this sounds like a new screening tool to do what folks are already doing on the ground. I think we already know what you are aiming to learn. The issue is finding resources to address these unmet needs. So I just want to, that's a comment that's come up a couple different times, but wanted to share Sue's thoughts there. And we have a couple folks with their hands raised who have been being very patient. So Ian, why don't you go ahead?
Thank you so much. Really appreciate being here. So I know that you're planning on doing continued outreach for people that'll be participating in this program. I guess my question, I work a case manager or a caseworker in Senator Sanders' office. So one of the common things that we've heard is, constituents trying to reach out to folks once they've been initially contacted. And so I guess like my question would be, how are you going to ensure that constituents or the participants in this program are able to reach out to the teams that they're working with? Like, are there going to be email mailboxes? Is it going to be like, are they going to have direct contact information? Again, this is just sort of like a common problem that we've been experiencing from constituents over the last 2 years.
So the way I can jump in on that. So as far as from ESD's perspective, we are treating this like a caseload. So we are providing the person from ESD's direct contact information on a letter to the group of folks they'll be working with, and that will be their main point of contact during this project.
Yeah, and from higher ability, be the same. We'll have a primary contact in each one of these districts that'll be the point of contact and provide phone and email for them to kind of reach out to them. So we guess it was the same for you, Renee.
Yeah, I think,
Yeah.
whoever their lead case manager is that they're working with, they would have their direct contact information.
Great, thanks. Good question, Ian. Thank you. Hannah from, Michelle Wright, Groundworks, maybe Hannah says, will this team be able to help support folks who are having issues with the motel management? Will the ESD team member be able to assist when there's maybe conflict between the transitional housing program participant and the motel management? And if you want to unmute and ask that question, if I didn't get it right, please feel free. Otherwise, Andy, I think that one's for you, maybe.
Yeah, I think that the team would. I think the team would help. Do what they need to do to help mitigate that. But that's how I would respond to that. I don't know if him or Renee, you feel differently.
Yeah, that sounds good, Andy.
Yeah,
Right.
Agreed.
So if there were issues, the team as a whole could support conflict resolution or dealing with motel management if there was an issue. Probably depending on the issue, the team would point that in a different direction. Okay. Angie White says, how will I think people learn skills to maintain housing, budgeting, being a good renter, participation? Wonder if having them prepare now before the storm happens. I did see that Jess Hyman from CVOEO dropped a link in the chat box to CVOEO's online Rent Right program and training. That's a great statewide resource, both for case manager level staff as well as participants. And so want to say yes to that. Let me go back to raised hands. Sabina from Groundworks.
Just curious, like, are you Groundworks employees going to be meeting with the local team or something along those lines, like doubling up on communication with them? Because I know a lot of our clients they get mail from ESD very confused. And I'm just not sure if you plan on just are on the map list that are already working with people that it might cause confusion or unneeded anxiety.
Sabina, thanks. You're cutting in and out a little bit there, but I think we got the gist of your question. And so I'll just name Groundworks is an organization that is known to be providing and receiving funding to provide housing support to people in motels and hotels. And so Groundworks would absolutely be invited to that initial local team meeting right before. Now, before that time period, there would be a notice that would go out. I'm not going to flip back to the slide, but there would be a notice that would go out to participants in the transitional housing program, right? And there would be, ESD would start to collect consent. I think we could make sure, I'll look to the team, but I think we could make sure when that notice is going out that it's sort of simultaneously that initial email is going to partners at the same time saying, hey, we want to convene this local team meeting. And we could probably even share a copy of that notice and release at that point with the team that's specifically going out in the district. We could try to work to do that so you all have that visibility. I think you're also lifting up other concerns, right, which are like anxiety and confusion on the part of clients who are now getting another letter from ESD and now being contacted to answer questions from new people and to sign a new release. And I think those are great conversations, I would say, for the local team to discuss the best approach and the best way to do outreach to clients based on existing relationships. That's maybe not a great answer to your question, maybe feels repetitive, but feel free to follow up. And state leadership team here that's here, is there anything you would want to add to that?
I just wonder, oh, go ahead, Andy.
I just wanted to, for the eligibility portion of it, we are expecting the ESD person on these teams to take over the eligibility so that no one's having to call the number to do a recertification or ask a question. They will work directly with the ESD person on their eligibility as well, so that we can make sure they have one point of contact for the ESD, for ESD program stuff.
Thanks, Sandy, for clarifying that.
And
Dave?
I wonder if it's helpful to maybe think about it in a slightly different way. Instead of it being a team of 3, I think really what we envision is it's a team that has 4 different roles on it. And there are 3 people that are staff from different departments of the Agency of Human Services that make up 3 out of those 4 roles. And then the 4th role really is the housing support providers locally. It's all of you folks. And engaging in that role in the way that makes the most sense locally and for your different organizations. But Sabina, to your point, your expertise and your knowledge and your relationships that have been developed over a long period of time and the countless hours that you all have dedicated to this is absolutely critical. And, it makes up a huge portion of this group together locally trying to do this work. And so, I don't know if that in any way is helpful or not, but I think it's important from our side to acknowledge the real critical aspect of the work that you folks provide and the expertise that you bring to the table.
Great, thanks, Dave. Molly, why don't you go ahead?
Hi, thanks. Sarah, you mentioned a couple times that you're sort of excited about the process of learning through this. And I'm also wondering about how this can be used to assess needs and potential interventions moving forward. And I'm wondering if you all have any like preset questions or hypotheses that you're looking to explore. I think some of the chat conversations have really suggested like this is going to be great for those folks who kind of need that shelter plus care level of support, and how do we get that going for folks once they're housed. So yeah, just wondering what sort of implications moving forward.
Hey,
Sorry,
Molly.
that was not a fair question.
I mean, part of this is that the data collection to help us learn what the needs and gaps are statewide and system-wide, so that hopefully, it gives us a starting point with some data, because anecdotally, we've known that these gaps exist, but giving us some clear numbers as to, how long is the wait for mental health services? How long have been people waiting, or, whatever the gap is, so that we can begin to address those issues at the state level.
And Molly, I think there's the long-term solutions to those. And then there's also the opportunity for the secretary's office to potentially engage in conversations in the short term and say, hey, this is necessary right now. And what do we need to do and leverage those different relationships, because the conversations and the communication happens on a fairly regular basis throughout the continuum. And so knowing with numbers exactly what that looks like, and then trying to push and pull levers when needed to really make a difference.
Great. And it could be, I mean, I know some of us would say, oh, we do coordinated entry, and that's meant to help us identify system gaps and resource needs. And so maybe there's, in my mind, some learning that can happen in asking questions in a different way that could inform future coordinated entry assessment. Maybe there's some learning there. I'll just add that. Breon Gallagher has added sort of a personal note, and she can't speak for her organization, but folks can't make rent even if they have 3 jobs sometimes. And it's so impossible, it seems, to find housing where they may need it. How do we support them finding things, and will there be additional support in this team to help them with the needs of kids transferring schools or job or career relocation planning? I think we talked a little bit about that and the need to connect people who are not living in the community that they aim to reside in. It's really hard right now because rent is really unaffordable. So just appreciate that comment, and I think we discussed that one a little bit. So maybe I'll move ahead. Just want to acknowledge Brattleboro. There's 3.5 case managers for the motel program, and they are looking forward to the support in Brattleboro. So thank you. Here's a new question. Is it possible to have the individual receiving transitional housing in the transitional housing program participate at the shared meeting? And so maybe Renee or anyone else want to talk a little bit more about the care coordination model as a whole. There was also a question around caseload, 100 people for the team. And so maybe you can just talk more about the care coordination model.
Sure. So I think after the screening is done, the team has come back together to identify who makes the most sense to either stay as the lead care coordinator or have them transition to someone else as the lead. But it could be that someone is utilizing the services of BCCI, of higher ability, of economic services, the housing coordinator, and maybe another mental health provider in the community. So we do have a tool that teams can use called a shared care plan that helps to outline the person's goals and then who on the team is responsible for addressing those goals, or assisting the person being served to reach those goals and take those next steps. So I think it's totally possible, and I think it would be wonderful if the teams wanted to come together and include the person in that conversation with the team to develop their own shared care plan. That would be best practice, but maybe not always possible. Depends on the team.
Great, and I did see a sort of a follow-up question here from Jess. And Jess, feel free to unmute yourself and ask any follow-up.
Sure. Thanks, Sarah. I'm thinking of all the effort that goes into even just getting one meeting with a household, given childcare, work, everything else they're dealing with. There's a lot of disappointment in systems right now. How much time can we be letting them know that you'll realistically be able to spend with them? Because 100 households per team is a lot, especially when it straddles multiple counties. I saw that the Burlington Middlebury team is shared. So
yeah, that's right, because they're working towards being 100 households. And so yeah, Middlebury having a smaller amount, that team would be working with both. So that's a great point, Jess. I appreciate. So both from how much can we communicate to a client around expectations, but then how that team then, which will have to be straddling multiple communities, there might be some added time challenges with that team as well, working with so many different partners. So kind of two great questions in there. Anyone want to jump in there, team?
Well, I think, and some of that will probably be determined by the team. So what I can say is what we've been doing so far. That's what I can speak to so far. So in Barry, I know at least the ESD staff person has started doing some out of hours work. So she's right now we're just in the Hilltop, and she's reporting there every day for work. So she's in the hotel, and if she's not able to connect with people during the day for some of those reasons you mentioned, she is going to adjust her schedule to be able to be there at different hours outside of our normal business hours to be able to connect with folks. So from our perspective in ESD, we are expecting people to be out in the hotels, the staff that we have assigned to this program to be out in the hotels, trying to meet and work with people. And so based on what they're finding for availability or people's schedules, I think that'll be a conversation we have about how do we flex schedules or do overtime or do what we need to do to meet people where they're at. So that's to be determined, but that's how we're doing it right now.
Thanks, Andy. Yeah, Hib or Renee?
Or, I think one of the other combo districts is Springfield and Hartford, and we're actually going to assign a counselor for both those districts. Even though it's kind of a combined team, we'll have two counselors, one on kind of the Springfield side. Aisha's on the call with us. Thank you so much for being part of this. And then we'll have another counselor on the Hartford side too. So I think we'll be able to maximize some of our resources by doing that as well.
So is a once a week meeting a realistic expectation for one household potentially, or is this, we'll see? Because that's
I
what
think
we
it-
would be providing at our agency, is at least once a week.
Jess, I think it's going to be dependent on people's goals and needs, so it'll be very individualized. Some people may already be connected to all the services that they need, and it might just be, a once or twice a month check-in to make sure that they don't need any additional assistance. And then other people may need a daily visit based upon their needs. So I think it will be very dependent on needs and goals.
And I would also say that recognizing you folks already have caseloads, right? There's households you're already working with and have great relationships with. And, so there may be a variety of different people sort of filling that fourth role on the team. And so we're not just talking about 4 individuals or 3 staff people from the different departments, really making sure that we're not duplicating what's already being done, and we're really just helping. If there's households that folks doing this work are having a hard time connecting with, that would be a great one for, some of the folks from the different departments to maybe try a different approach with, or maybe can come back after hours or get a little bit creative, or maybe it's just a new person, that's able to try to connect with them, and that allows folks with a full caseload already to focus their time and attention on other households that are doing a great job of engaging with them. So, that fourth spot, which is really all of the different community partners, to the extent to which they're able and willing to engage with this, may bring a wealth of information, but also, to your point, if you're already connecting with households once a week, that's fantastic. Like that frees up the team to be able to focus on other households that maybe aren't part of your current caseload.
And there's some assumptions, right? There's some assumptions that there are participants in the transitional housing program out there that aren't well connected to services, housing support, health, employment, or other services, and that this team can help reach them and help them get connected. And you all best know how large scale that issue is in your communities. And so for some of your communities, maybe that's not a realistic assumption. Maybe everybody is really well connected. Okay, that's fair. That's fair that this is built on a certain set of assumptions that may not hold true, but hopefully you all can shape it to still be of value in your community. So Katrina, I also see that you had a couple other kind of questions, and I see Tara Chase as well has something, but first I go to very patient Felicity, who's raising her hand.
I don't know how to take my hand down. Okay, I guess it went down. So you can all hear me. And
yes,
I apologize from the get because I just feel like I'm a little late to this party. How did this happen? Where did this money go? When was that decision made that the transitional housing program would end? And when did we miss our chance to, I just feel like all due respect to you guys, but Vermont's in a crisis with housing, and you're going to take away the one safety net, right? And so in a very real sense, I'm working with someone who is over 60, has lived on a piece of land that his family owned forever, does not have running water or electric, was in a mobile home, which because he's on disability, didn't have enough money to repair, wasn't connected to services. Now he's just on wait list. He has called 211 multiple times after hours, cannot get in a motel room, is sleeping in his vehicle.
So
You know,
Felicity, I just want to make sure, because the meeting's recorded and it
I'm
is
not
a
saying
public
his name.
record.
I have no intention of
Okay.
saying his name.
Yes, I
I-
also just want to be careful about the level of case level information we're sharing, because we know it's a small enough state. So
Right. I'm
continue
just
with your
shocked that, you
comment.
know, that
Thank you.
there's, you're talking about like people working and people having childcare, and we have people who are elderly people who will not be able to work, who will never be able to afford a market rate apartment, who cannot even get in the motel. And I just don't understand how this happened. And I'm not hearing any solution for him specifically. We've done all the steps we're supposed to do. So I just think that this is not really, I just feel, I'm a little distraught. I feel like we're all talking about things, but that the problem is really not going to go away. And in fact, I think the housing, the unhoused issue is just going to be worse, much worse, when transitional housing is not available. I don't think there's any degree of case management that can create housing.
Yeah, thank you. Thank you for putting a pin on that. Last point, I think, sums up some frustration that you're feeling, that I think others maybe have also articulated today, that case management itself doesn't create housing, and that's sort of a fundamental piece of the puzzle for people. I also, Felicity, I don't know your organization. I'm sorry.
Was there a
Let me just
vote on the
finish.
state level that I missed? Or?
No, Felicity, let me finish, because I'm not sure your organization. I'm happy to follow up with you separately about if you want to put your contact information in the chat box, or I'll put mine there and you can follow up with me, because there definitely are lots of other conversations and tables where there's a broader conversation around the housing crisis response and the tools that we need and are working on or talking about in the state and the community level. And that wasn't the goal of this conversation. And that is a really important conversation to have. So I want to name that you're identifying that this feels like it's missing the point, but I hear you about the point, and that other conversation's also happening. And I'll just speak for myself, and I know many partners here have been attending local homeless coalition meetings all month long, talking with people about the housing crisis, what's next, and what some priorities are in communities, and what solutions need to be on the table. So that is a really important conversation, and I'm sorry it's not the one we're having specific, exactly today. So thank you for your comment. And I'll put my address, my name in the chat box. There's a couple other great questions, I think, and one of them is from Allison Calderer, who had to jump off the call, but I want to make sure we get to it, which is, hey folks, hey state team, Hib, Renee, Andy, Dave, how would you define success for this project? What difference do you imagine seeing at the end of the project?
I mean, I'll speak for hireability. I mean, there's people out there that, we haven't touched. I mean, it might not know anything about our services. And so one thing for us is to kind of make them aware of what we do and do the best thing we can. We have resources to provide assistance with training, vocational assessment, all kinds of different things. We have certified work incentive counselors that can work with people who are receiving Social Security disability to kind of understand how those benefits are impacted by earned income, because a lot of folks that are on disability are feeling like they can't work or they'll lose their benefits. In a lot of cases, by going to work, they end up earning more money. And we have staff that can really help them understand how that works. So, I mean, for me, I'm hoping that our involvement in this project is gonna just be beneficial to whoever it is we serve, to kind of help them move forward in some way towards employment or training, or putting themselves in a better position come March 30th.
Yeah, and I would say, I think, oh, go ahead, Renee.
Sorry, I was like delayed unmuting myself. I was just going to say to Allison, I think that one of the goals of VCCI would be that everyone, is signed up for Medicaid if they're eligible and is connected to the healthcare services that they need.
And I think broadly, it's really just about learning, right? Sarah mentioned earlier, the goal of this team is to be in effect through the end of the transitional housing program. We may learn something that changes the scope of the approach that gets taken. Like, I think we're trying to look at this in a way of saying, what can we learn about the different relationships, about bringing the variety of different departments at the agency together, working with community partners? What can we make sure that we learn and can put, real solid numbers to about the situations that Vermonters are in, and the barriers or the gaps in resources, and how can we use that information to be able to make informed decisions moving forward that will have a real impact on Vermonters as a whole.
There's a great thank you. Thanks, Dave. And I think we shared, some high level goals in the slides at the beginning in terms of results that each of these folks are sharing from their seat what they're hoping to achieve, and at a high level what the agency is hoping to achieve as well. There's a couple of other questions. We've got just 5 minutes left, so do feel free to raise your hand if that's easier. And there is a question about how the project is being funded, and some thoughts on, I think, ROI, meaning return on investment for this work. And I think we just talked about results, but I don't know if anyone is able to answer the question around how it's being funded. And if not, that could be a question that we can follow up with for transparency. Dave, maybe that one's for you.
Yeah, I don't. To the best of my knowledge, the work that's going on from the different departments is just regular payroll and normal expenses for each of their different departments. If that's not accurate, I can loop back around for transparency.
I mean, for hireability, if you have some type of disability, which a lot of these folks are going to be eligible for our services, you'd be part of the population that we'd be working with anyway. So anyway, we're not looking at a different funding stream to kind of do this work.
And I'll just name that I also see Sarah Truck from the AHS Secretary's office just is here and turned her camera on. I think she could answer this question for us.
Yeah, so the agency is really prioritizing this project and pulling resources from VCCI, from Dale, as well as from DCF, and really refocusing those staff in this way. But the funding streams behind them is ultimately comes down to how we cost allocate based on the moments. So we're not creating a new initiative, but rather reprioritizing that funding stream within that, and looking at what the impacts will be across from that. As we backfill staff, we do anticipate some additional pressures, and we're working through that right now. But in general, the staff are inherent to state employees, so they're covered by the appropriations of the Pay Act. That's helpful.
Thanks, Sarah. And I think there are a couple of other great questions in here. I think Springfield, you had a question specific to your district, so I'm gonna let you take that offline when your team meets, and you can talk about how that will work. I saw Jess Horner's question about the screening tool. I hope it's asking who are you already working with the community, and Jess, that is exactly the point of the screening tool. So I'm sorry that final tool isn't done yet, and the team wasn't able to share that today. But when you see that, I think it's not the only kind of question on the screening tool, but it is one of the main points. So thank you for lifting that up. And just want to name, I saw a couple other questions here. Appreciate people bearing with us today, sharing your frustrations, being really honest about that so that this can move forward in the most successful way possible. I think you have a very thoughtful group of leaders in Dave, Hib, Renee, and Andy who want this to work well in your communities. And so as it's coming to your community, we'll share these slides, we'll share the recording. If there's others in your community that could benefit from watching the recording and looking at the slides, please share them. And if there are additional questions afterwards, I did share my email in the chat box. I probably can't answer your questions, but I can point you to the right people who can as well. And so I'll just say my email as well. So it's Sarah Phillips, SARAH Phillips, PHILLIPS @vermont.gov. And so I'm happy to help connect people to the right point person. So we're at time today. I think we did get through the vast majority of the questions. Thank you, Hib, Renee, Andy, and Dave for joining us today. And thanks everybody else who made time to be here. I really appreciate it. Have a great day.